Prof, thank you for joining me. So, a recent report from the South African Depression and Anxiety Group signals that the number of calls that they've been getting daily doubled during lockdown. So they would previously get about 600 calls to their helplines, but now they went all the way to 1,200 and even 1,400 calls daily. 500,000 people reaching out in the past. Is the situation as dire as we are told it is, in as far as mental health is concerned, and the effects of lockdown on mental health?
Yes, because we're confronted with a phenomenon that we've not been used to ever in our lives. The isolation from each other, the inabilities that are imposed in terms of our movement, in terms of our work and recreational engagements. Importantly, our inability to be human through direct and other contact with fellow human beings is a serious issue that confronts everybody, not only in this country, but all over the world where these conditions have been imposed to curb the tide of this coronavirus.
So talk to me about the other consequences of a lockdown, the threats and loss of income and livelihood with, the attendant consequences in people's lives, the whole issue of, people losing their jobs. How much of a factor has that been?
Well, in an environment where we have such high unemployment before the advent of the pandemic conditions, where many, many more jobs have been lost and people have been forced onto the dole queues, if you like, getting handouts and so on. That impacts and must affect how we think about ourselves, our value, our worth, and also how we're going to see the next day through. These are factors which impact on all of us because we don't know what, except for a small percentage of the population, we don't know what the next day will bring. The cold comfort is that all of us are in the same boat, except for that small sliver of people who have a buffer against these kinds of conditions. So I think the responses have been good initially from government, but appalling thereafter, and the result of exposure by the media, of pandemic profiteering and the kinds of things that we've had from people who are leading the campaign on behalf of government against the virus speaks volumes. Our people do get, all of us, do get despondent because if we look at the scandals associated with the Ministry of Health, for instance, leading political and other figures, these will impact on us. And I think the kind of rising tide of anger and frustration that we see on social media, the defiance that we see where people just refuse to do things that will protect them, is exemplary of that situation. Because people have no other recourse, so they turn on themselves and others.
Prof, how do you gauge our response to the growing need for mental health services? I mean, if this report from SADC is anything to go by, 500,000 people reaching out to SADC since March last year to the end of February this year. So clearly there's growing demand. But we already had a mental health problem prior to the lockdown. I mean, one goes back to the issues that cropped up at the Tower Hospital in Fort Beaufort in the Eastern Cape, and that highlighted the psychiatric help health issues that we have in our system, but even in the prisons, that continues to be a problem. Did we seize then the opportunity that now that we see that there's a growing demand for this kind of services, let the response be holistic and include a response to mental health issues?
Well, look, the World Health Organization, the United Nations Secretary General, have pointed out the need for mental health intervention and support. Our country is appalling. We have actually had a lessening of the priority on well-being, that many government departments employ private contractors to provide services, but when it comes to the general population, we are left on our own resources, and we end up in the facilities like the one you mentioned as a last resort. We ought to be implementing a massive prevention program, a health support promotion program that includes psychological and physical and emotional well-being. That is cheaper than providing the symptomatic kinds of interventions where somebody has a breakdown, somebody has a serious episode of one kind or the other. And we have not integrated that. We tend to trot out all sorts of nice policies, but in the implementation, we are found seriously wanting.
Yeah.
The Psychological Society of South Africa, of which I'm past president and a sitting council member, offered government in, I think it was end of March last year, April, a program to help frontline health workers. I think the mistake we made was not to say it would be provided gratis. If we said it's going to cost you 30 million, I'm sure it would have been contracted out at probably 40 million, and somebody else would have made the money out of it.
Professor
That's
Saths
part of the problem.
Yeah, completely out of time. Sobering commentary there that you give around that particular issue. Imagine if someone surprised us and decided that mental health issues are something that they will take seriously, and we'll see some of the programs that Professor Saths Cooper talks to there. That would be interesting.